Well, good morning. Thank you for being here today. My name is Melissa Atlas, and I'm a licensed clinical social worker and licensed clinical addictions counselor. And today I want to talk to you guys about addiction and the brain. So what I'm going to do is kind of talk about the different regions of the brain that are affected by and part of addictive disorders, and hopefully that will help you and your family gain a little insight into what you've been going through. So please forgive my drawing and handwriting. We're going to do our best today. But we're going to pretend that this is a cross-section of the brain kind of looking in from the side. This would be behind the forehead. This would be down kind of back here. And the reason we're talking about this is because we at Franciscan feel that addiction is a brain disorder, and that is backed up by the National Institute of Drug Abuse. That's also the National Institute on Alcohol Abuse, as well as the Surgeon General. So what I'm about to talk to you about today comes directly from the Surgeon General's report from 2016. So if you're super nerdy and looking for something to read, that'll put you to sleep. But this is kind of distilled down for that so you can use it. So what we know about the brain is that different regions control different functions. And there are three main players when we're talking about addictive disorders. And the first one I want to talk to you about is sort of located right here in the center of the brain, and it is called your amygdala. And the way I talk about the brain is I talk about it from the standpoint of evolution. So the more centrally located in the brain, the older it is to the individual and to the species as a whole. So the amygdala is right there at the very, very heart. And it's kind of the part of the brain that we share with snakes and lower function, like invertebrates and things like that. And its job is to keep you alive from immediate threats. So this is what we will call your go system. So if you are walking on a hike and you cross a path and you see in front of you a snake go across your pathway, this is the part of your brain that's going to jump back physiologically before the rest of your brain even registers the word snake. So it's this very automatic process that you are not totally in control of, but it is definitely crucial to your survival. The other thing that this part of your brain does is in that moment of fear, your brain kind of takes a sensory snapshot of that moment. So the next time you're on that path going for another hike, you're going to come around a corner and be like, wait a minute, that's where that snake was. Like, I remember that tree. I remember what it smelled like. So all of the senses kind of take a snapshot of that moment and kind of encode it so that it knows when the next time a threat is present. We'll come back. The next region of the brain I want to talk to you about is the basal ganglia. And so this is the part of your brain that we will call your woohoo system. Let me be consistent here. So this is the part of your brain that we refer to as the pleasure center. So when you have sex, when you eat chocolate, when you have bacon, all of that good stuff, right? This is the part of your brain that lights up with these feel-good chemicals like dopamine and endorphins and all that wonderful stuff. The question becomes, why do the things that feel good to human beings feel good, right? So if we were to look at, say, a spinach molecule under a microscope, we'll see chlorophyll and some other stuff. And if we looked at like a honey molecule, it wouldn't look all that different to the untrained eye. But the basal ganglia knows the difference between sugar and chloroplast. And what it does that for is because most of our evolution has included starvation seasons. So you just didn't know when your next meal was coming. You didn't know what you were going to be able to eat. So that if you came across a cachet of something really fatty or something really sweet, you would probably eat as much of that as possible. Why would we do that? Well, it helps us gain weight around our middle so that if we didn't eat for the next 2 weeks, we had some fat stores to draw on. So the basal ganglia keeps us alive by reinforcing pleasurable experiences that are going to make our survival easier, better. The other thing that it does is that when that experience is better than normal, you get a bigger hit of those dopamine chemicals. And that wakes up the amygdala and says, oh, we need to do this as much as possible, right? So the pleasure lets the amygdala know that this is important for survival. It does that through some other learning neurotransmitters that if you're super nerdy about, you can learn about on your own. So there's those two systems first. The last system I want to talk to you about is right behind the forehead, and that is your prefrontal cortex. And this is what we will call your stop system. So this is the part of the brain that is the last to come online. So teenagers don't really have this fully formed yet. This is part of the reason why you have to be 18 to vote, 21 to drink. It's also part of the reason that teenagers do dumb things like the Tide Pod challenge and car surfing, right? There is no future them, because the part of the brain that helps them make those kinds of decisions and distinctions, weigh out risks and rewards, is not fully developed until your mid-20s, right? So in a normal, healthy, functioning brain, how this would work is, let's say you walk into Target, which none of us are doing right now because of social distancing, but you get my drift. So you walk into Target, and lo and behold, you see the newest, latest, greatest 4K ultra high def screen for $800 at 75 inches. It's amazing. And your basal ganglia has taught your amygdala that Star Wars in ultra high def 4K looks awesome. It's a pleasurable experience. And so your amygdala starts to reach for your wallet. But then your prefrontal cortex says, hang on a second, rent's due tomorrow. We don't really have the $800 to spend on that. So it helps you pump the brakes, exert some control over your impulses, and you live to pay your rent. Potentially, right? Same experience, but your prefrontal cortex says, you know what? We just got our tax refund. We have a little bit extra cash. You go ahead, right? So it helps you know when to go and when not to go so that you can survive in our current society, right? So that's how that process is supposed to work. So let's start talking about substances that people tend to use. Alcohol, methamphetamines, opioids like heroin, pain pills, marijuana, nicotine, all of those substances that you can name act on the basal ganglia in a much more powerful and potent way than even things like sex and bacon, right? So it produces this really magnified reward system. So that when that first experience, your basal ganglia lit up with activity and sent that message down to the amygdala, and now it's like, oh, we need to do this all the time, right? Because it was a better than predicted reward, and evolution has programmed your brain to latch onto that really tightly. The other thing that we need to reckon with here is that most people who wind up having an issue with a substance use disorder probably started using before the age of 25. Not in every case, but most of the time. There's at least some experimentation. Even if it was social use, appropriate use, or whatever, they're still introduced before that prefrontal cortex is even fully formed yet. So there is no system in place to help the brain exert that impulse control. So what we have is this very powerful drive that gets encoded in your amygdala as crucial for survival. Let me say that again. The substance feels like it's crucial for survival, right? So if I were starving, like literally starving, not American starving because Uber Eats is like a little late to deliver to me today, but like actual, I'm about to go into system failure if I don't eat soon. What wouldn't I do to eat? I'd do anything. I'd lie, I'd steal, I'd cheat. And I probably wouldn't think twice about it, and I also probably wouldn't change my opinion of myself that much because I had to, right? So when the person becomes addicted, and we'll talk more about what that means in a second, that is what's happening, right? I don't love the alcohol more than I love you. There's a part of my brain that is literally screaming that if I don't get this soon, I'm gonna die. That's a really, really powerful drive that has driven much of our culture, much of our society, right? Human survival has done a lot. And when we are talking about addiction, we are talking about an ancient system that has been hijacked by a substance. It's a little like demon possession, and it feels awful. And it's very confusing to the person that's going through it. Because I know rent's due, I know my family's mad at me, I know that I'm about to lose my job. I don't like stealing grandma's pearls, right? I don't want to do that. And so my prefrontal cortex may be yelling at me. It's just not quite as loud as the amygdala, right? And so that becomes a very, very difficult process for the person. The other thing I kind of want to talk about here is that a lot of people ask, why me? Like, other people can drink and it's not a big deal. Other people can use, pain pills and not get addicted to them. What's going on there? Well, there's a couple of different things that we kind of have to go back to good old Psych 101. So what that means is what I mean by that is there are two kinds of reinforcers. It's a little confusing, but I'll try to break it down. There's positive reinforcement where I give you something, and negative reinforcement where I take something away. That doesn't mean that positive is good and negative is bad. It's just whether I'm adding or subtracting, right? So when I'm 16 and I go to my first high school party and somebody hands me a tequila shot and I do that and my basal ganglia is like, whoa, that feels great. Like that's a positive euphoric experience. That is a positive reinforcer. And that is somewhat addictive. The people who wind up developing a severe addiction experience a negative reinforcement when they use their substance. And what I mean by that is it doesn't give me something, it takes something unpleasant away. So if I've been struggling with social anxiety my entire life, and I walk into that party as a 16-year-old and I get that first shot of tequila, and my amygdala is like, wait a minute, I'm making people laugh. People want to talk to me. I'm comfortable talking to them. I feel like how I'm supposed to feel all of the time because it's removing that social anxiety. That is a much stronger indicator that I'm in some trouble and I'm at high risk for developing a substance use disorder later in life. If we think about that in terms of stimulants, for example, if I've been struggling with depression for a long time and then I get this big hit of euphoria that comes with a methamphetamine high or a cocaine high, again, it's taking that depression away. I have energy, I have motivation, I care, I feel good, and that is removing the discomfort of the depression. The same thing could be true of opioids, right? We have opioids because they help us manage pain, which is a beautiful gift, but if I'm in chronic pain kind of all the time, if I'm in emotional pain all the time, and then someone gives me something that takes that pain away, even just for a little while, that's going to be a very powerful connection that my amygdala makes. And that need to continue to do it will be strengthened. Once I get to a point of the cycle of I use, I withdraw, I crave, I use, I withdraw, I crave, that sort of later stage of addiction, that gets reinforced because I have the euphoria, and then the mirror opposite of that is my withdrawal symptoms. So if I'm taking opioids, I like the feeling of no more pain. Withdrawal feels like the presence of pain. That's like my amygdala is going to freak out a little more. So when we have those risk factors, you don't decide that, right? Every other 16-year-old was at that same party taking that same shot of tequila, and maybe they just got the woohoo feeling, and it was the end of it. For me personally, I take a drink, I need a nap. The only thing that happens to me is that the room takes a second to catch up, and it's super annoying. It's not my jam. But for other people, when I feel that relief, that's going to be a much more powerful connection. Real briefly, I want to mention that the amygdala has a role in trauma, right? So if I've lived through things that have been traumatic, I felt really afraid, bad things have happened to me, and I can take a picture of that brain and I compare it to someone who didn't have those experiences, the amygdala is larger in size than the non-traumatized brain. That would make sense then that people who have addictions tend to be way more likely to have experienced trauma, particularly in early childhood. I'm not saying it's mommy daddy's fault. It's not that so much. But if my amygdala is kind of always on high alert and it's just functioning at a like those 90s car alarms that like someone would clap a block away and they go off for an hour. That's what the traumatized amygdala is like. It's just constantly on high alert. You give it something that calms that down, it's going to feel like a gift. And so that connection between trauma and addiction, for women, we know that up to 80% of women who have addictions have a sexual trauma history. That number is lower in men, but my guarantee is that that's probably underreporting rather than not happening, and then it happening at a lower rate. This is usually when I break for questions. So, if you pause here, take some notes, call your therapist, we can talk some of this stuff out. It's a lot of heavy material. The other thing I want to mention is that So remember when I said something about how if I'm walking in the woods and I'm going down the trail and I see the snake, I take those sense memories. Well, every time you use a substance, your amygdala takes a snapshot. So if you were listening to Comfortably Numb while you're getting hammered, your brain remembers that on the level of the amygdala, right? So there's just that intake of all that information. You remember who you're with, you remember what you smell, you remember the time of day. And every time you use, you're reinforcing those connections. So when you're trying to stop using, right, your prefrontal cortex is trying to exert some control over this process, you may see, smell, experience sensations that remind your amygdala that the drug was coming. And that leads to the feeling of craving, right? So that's why I may drive my same route home every day, but I start to feel a little nervous around the same point every day. And if I'm paying attention, maybe I'm driving past the exit to the dope man's house. Maybe I'm driving past the liquor store where I used to stop and buy my liquor. Your amygdala remembers. And so you're going to experience that urge to use even though you know better. I was a vegetarian for 10 years, and it didn't matter how long it had been. It didn't matter if I had just eaten. If I drove past a Burger King, right, that smell of the flame-broiled goodness would produce a response in me. I'd start to salivate and feel hungry. I didn't want the meat. I didn't want a burger all of a sudden, but I was having a below consciousness trigger that caused a physiological response in me. And so even though I know better, even though I don't want to do this anymore, even though they're going to take my kids, take my house, my wife's going to leave me, all that stuff is true. If my amygdala continually gets triggered, I'm going to really struggle with a lot of cravings in early recovery. That's not a failure. That's not, doesn't mean you don't want it. Right? It just means that there's something that's sort of primordial, that's a little more powerful, that you have to be honest about. Right? Because the presence of craving does not indicate a failure, does not indicate that treatment's not working, it doesn't indicate that you don't want it bad enough and all that other stuff that people say to people in early recovery. It just means that you are in fact experiencing addiction, and you're going to experience cravings from time to time. Now here's the fun part, right, that AA and 12-step programs have known for a long time. It's why I have a job. What we know is that if you want to get through the craving, you have to move it out of that nonverbal region of your brain and talk about it. It uses a different set of skills, it uses a different region of the brain, and it reduces that intensity. What a gift, right? And so it's not just nice to talk about your feelings, it's not just nice to it's more than just so I can have a job. It's really because it allows you to exert some measure of control over this impulse that has been running riot in your life. No one chooses this. You know, no one says, you know what sounds awesome? Screwing over everyone who's ever loved me, wasting all of this money, putting my liver at risk, my health at risk, my kids at risk, my job. People don't do that, right? This is a tragedy that's happening to people on a regular basis. And so if you're someone who is dealing with an addiction yourself, I will encourage you to surround yourself as much as possible with people that you can call and talk to and say, hey, I'm craving right now. Sit with me while this passes. If you're a family member and someone chooses to say to you, hey, I'm having a really tough day, I've been thinking about using a lot, please don't judge them for that. That's not a decision they're making. They're doing what I've told them to do. They're doing what they're supposed to do and sharing that information so that they can exert a little control over that. It has nothing to do with you, right? It's that automatic response. I mentioned Psych 101. We're going to go back for a second, right, and think about Pavlov's dog. So if that's not something familiar to you, I'll explain it, and if it is, you can skip ahead a few seconds. Essentially, this guy had a dog. He would feed him, ring a bell, feed him, ring a bell, over and over and over again, until eventually, just like me and Burger King, we ring the bell, and the dog produces saliva without the food being present. So food and bell have really nothing to do with each other until that repetition made it be reminiscent, right? So that's kind of like I'm walking into the liquor store and I'm stopping shaking from withdrawal symptoms because I know that the substance is imminent. I feel better on the way to the dope man's house than I did before I even take the substance because I know it's coming, right? That amygdala allows me to calm down for a second and pulls it out of that region of intensity. So hearing comfortably numb, I use it, no, it doesn't matter. Seeing, smelling certain times of day, whatever, those experiences, if you stop using long enough, those triggers will kind of drop down to zero. What they found is that they rang the bell and didn't feed the dog. After a while, that de-paired those two things. So it will get easier. It will get better. Unfortunately, they feed the dog, ring the bell one time, and the response goes up to 100. So if you use something, even if it's not your main drug of choice, and I'm looking at all you people who are telling me that weed ought to be legal, it's still likely going to produce those cravings and go right back up to the struggle, right? And so I'm not trying to, that's not a judgment, it's trying to protect your brain from itself. This is not an easy thing, but I know that you can get through it with support, and that's what we're here for. At some point we'll be together again in person, and I'll do the same talk again. You can ask all your questions. But please do feel free to share this as much as possible with your friends and family, just to make sure that we're all in this together, and that this is a disorder, not a moral weakness. All right. Thank you for your time.